different people, constipation means different things. So it is actually very important for me to actually ask, what do you mean by constipation? When they say constipation, it might mean things like, oh, I have got hard stool, I need to strain very hard when I pass motion, or I pass motion once every 3-4 days and all that. So it's actually important to have an idea of what it means. How much fiber the patient takes. In addition, we do ask about a drug history because certain types of drugs does affect the movement of the gut, right? For example, things like antidepressants and some high blood pressure medicine as well does affect. So we do actually check on that. We would like to find out a little bit more about their conditions. If they have got some sort of neurological condition, or for example, things like even Parkinson's, a stroke before, mini stroke before and all that, we do know that that also does contribute to the constipation as well. And things like even their thyroid function, if they are hypothyroid, that also can give rise to constipation. So when a patient comes in with the complaint of constipation and already having excluded things like cancer and all that, and we found that it's mainly functional, I would find out from them is what type of stool that they have. This can be seen in the Bristol stool form scale. And if you look at it, there are 7 types of different types of stool, and having an idea, like for example, type 1 is one where there's like little marbles, and these are really hard stools to pass out. Type 5, 6 and 7 are softer stool, which you tend to see when a person goes to pass motion a bit more frequently. Roughly, we can classify them into constipation due to what we call a slow-moving colon, or the other one is where there's discoordination of the muscles. What happens is your abdominal muscle needs to squeeze, okay, and your pelvic floor muscle, which you see here, is supposed to relax, right? And so if you see the rectum is kept in a kinked position, and when the pelvic floor muscle relaxes, this rectum straightens out, and then with the increased pressure when you squeeze on your abdominal muscle, you're able to push out the stool. So some people throughout the years, they lose that function. So eventually, instead of relaxing this muscle, they end up squeezing this muscle, and this is what we call pelvic floor dyssynergia. Okay, so this is also something that we look out for in patients with functional constipation. And in order to investigate this, we do a series of tests. So to look out for slow transit constipation, we actually get the patient to swallow a pill, and inside there are 24 little rings. And then usually what happens is these are what we call radio opaque. They are visible on x-ray, and we take an abdominal x-ray after about 5 days without any laxatives. And this will tell us whether you have got a slow moving colon or not, because usually by the 5th day you should have passed out at least most or at least 80% of all these rings. But if you are retaining these rings, then that will give us an idea of the patient having a slow moving colon. Another test that we do is a Cinedefecography. We put some contrast to simulate stool into the rectum of the patient, and then we get the patient to have a poo during the period, and we take multiple x-rays like a video, and from there we can actually see the position of the rectum, how much effort the patient puts in passing out the contrast, the stool, and from there we can also see whether the rectum straightens out and whether there's any bulge in the rectum into the vagina, which is causing some stool residue to hide in the pouch. So from there we can actually see what the patient goes through when they have a bowel movement, and so we can have a better understanding of that. Slow transit constipation is a little bit more tricky to treat. There is no real magic pill to actually resolve slow transit constipation. It's just that the colon's rhythm is a little bit slower. I know a lot of patients with slow transit constipation, they tend to actually take laxatives. So actually, in actual fact, laxatives are not good for the long term, especially those with things like senna and all that. And sometimes you can actually see patients on long term, or even slimming tea, which has got senna as well. Yeah, those in the long term can actually affect the nerves of the colon and make it go a little bit slower. So if I do see somebody who's on long term, I will try to wean them off these medication and try to use other things like getting them to actually exercise more and all that to stimulate the gut. Even by moving, you actually stimulate the gut. You want to increase more movement in the colon. And looking at the diet and all that, we can see how we can help and all that. Yeah. Yeah, I think sometimes some of these conditions are unavoidable. As we grow older, our colon rhythm and motility, the movement, actually does slow down. So that's when the constipation sets in.